Welcome to part 3. We're going to be looking at monitoring and funding for community-led monitoring and accountability. And this is the third of 5 videos in the course. The learning objectives for this session are to support understanding of the key mechanisms and actors involved in monitoring, global fund and USAID HIV programming and expenditure, to build knowledge of indicators, frameworks and how to use them, and to build skills in identifying the mechanisms for accountability. And the content will cover 3 areas: broadly, funding for accountability and community-led monitoring, which stakeholders are monitoring programs and expenditure, and what is being monitored, the role of indicators. Starting with the first, funding for accountability and community-led monitoring. Community-based monitoring is one of 4 priority community system strengthening interventions that the Global Fund is prioritising. And the Global Fund is aiming to support the scale-up of community-led monitoring with civil society and technical partners. And the Global Fund strategy development process will also give chances for civil society to influence for community-based monitoring or community-led monitoring to be better integrated into programs and investments from the Global Fund. At the moment, there is technical assistance that's being provided to ensure that USAID and Global Fund programming aligns, and there are 2 groups involved in setting this up. This is the Alliance for Public Health with INASO and HealthGap. And if there's no existing mechanism in a country, the Community Rights and Gender Department provide technical assistance to communities and civil society to develop a strategy for community-led monitoring. And this is through the Community Rights and Gender, or CRG, Strategic Initiative. Additional technical support is there for certain countries through the Resilient and Sustainable Systems for Health, or RSSH, Service Delivery and Innovation Strategic Initiative. In the new funding stream under the COVID-19 response mechanism in the Global Fund, community-based monitoring sits under community systems strengthening. And the guidelines for this stipulate that community-led monitoring should be included in all grants over a value of $20 million US dollars, or those grants with strong community elements. And they suggest to include things like health facility assessments, data quality reviews, COVID-19 monitoring surveys led by partners, program reviews, and country evaluations. And for a nice example of opportunities or entry points for integrating community-led monitoring into those funding requests, have a look at INASO's Community-Led Monitoring Technical Guide. Here is a screenshot from that guide, and you can see within program reviews, national strategic plan development, funding request development, the technical review panel, in the grant making process, and in the grants approval committee, there are multiple opportunities here for influencing, and there are key questions set out within this guide which are extremely useful for thinking through how you might do this. Here is a great example of how funding community-led monitoring can be really impactful. So this example is from the International Treatment Preparedness Coalition, or ITPC, and the Global Fund supported them to set up a regional community treatment observatory. So this is a type of community-led monitoring in West Africa. And this was done in 2017 and later expanded to Zimbabwe, Zambia and Malawi. And it aimed to improve accountability to reach the 1990 UNAIDS targets. It gathered different types of data on the availability, accessibility, acceptability, etc. of HIV care, as well as on COVID and human rights violations and other diseases. And they used different techniques, including interviews, focus groups, health facility visits to do this. The data highlighted critical gaps in the care, and these findings were used to engage with facilities to come to create solutions together, and using the evidence base to support advocacy for national change as well. And it had great successes. 3 years after the Regional Community Treatment Observatory was implemented in West Africa, stockouts of antiretroviral therapy and reagents for testing viral load decreased respectively. Rates of HIV testing and ART uptake increased, treatment monitoring improved in Mali, you had site-level data tracking mechanisms revised in the Gambia, and user fees, which are a major barrier across multiple countries and multiple diseases, were eliminated in Côte d'Ivoire. At the more strategic level, the model was integrated into national strategic plans in Malawi and Zimbabwe, and this catalysed support for other routes, including the National AIDS Trust Fund in Zimbabwe. And in Malawi, the model was included in PEPFAR's COP 2020 as well. Now moving on to the second part of this session, which stakeholders are monitoring HIV programs and expenditures? Let's take a look. So first I'm going to go through who you can connect with. Who are those people or bodies that are involved? So the National AIDS Council is a very obvious one to go to first. This is the body that coordinates and monitors the national response to HIV in each country. Usually with strong connections to the Ministry of Health, they develop strategies and policies, they mobilise resources, and they monitor its implementation as well. They develop the national strategic plans that is the blueprint for the HIV response in that country. The country coordinating mechanism, as already touched on in the previous session, is that national level stakeholder partnership bringing together NGOs, different agencies, public and private actors, and people living with or affected by HIV, TB, or malaria. And they have oversight of principal recipients. You also have community consultative groups who are a key body for community-led monitoring because they explicitly support its implementation and design. And they're a technical advisory board of different representatives from key populations, people living with HIV, different global agencies, government organisations, community partners, and sometimes research institutes as well. And they support data collection, analysis, and advocacy agenda setting. They can also leverage funding for community-led monitoring as well. So they're a key body to connect with. Also incredibly useful is the HIV Situation Room. These are not in all countries, but they have been set up in some. So they were created by the Gates Foundation and are led by UNAIDS and include the Global Fund as well, amongst other actors. They focus on monitoring and evaluation, and their aim is to support governments to align all the indicators on HIV programming from different donors and have systems for reporting talking to each other. So it makes it easier to visualize and identify data gaps and trends. An example of this is the Kenya HIV Situation Room. This was the first one. They have an interactive dashboard to track all that data, and they take the information from different monitoring systems, as well as from private sector systems, population-based surveys, health estimates, and this is being used by policymakers to inform their decisions. And you can go to these different links to find further information on this. There is one in Uganda as well, launched in 2018. This is led by the Uganda AIDS Commission and the Ministry of Health, and each one can have a slightly different focus. So this one looks at HIV, TB, and sexual and reproductive, maternal, newborn, child, and adolescent health, using data from slightly different sources, and it can use mobile devices as well, and includes public access through a web portal to use the data. And here are some key contacts and the different actors as well who are involved in this. Now looking at other actors and platforms, so PEPFAR, their country operational plans, as we've already discussed, are the main mechanism to influence funding and programming decisions in national contexts. There is a regional COP or ROP in Asia, and most African countries have national COPs. And you can see the different contacts here if you want to find out further information about that. The Global Fund, again, previously we've talked about the Global Fund Board being the governance mechanism for the Global Fund. The fund portfolio managers are also an important connection point. They hold the principal recipient update and disbursement requests, which are the monitoring framework for each country. So these are called the PUDRs. These show what indicators the Global Fund are tracking at the national level. So these are very useful as a way to cross-check and to find potential indicators that you might want to use for community-led monitoring. Now, you also have UNAIDS, so they have a monitoring and evaluation team for each country, usually linked to a partner organisation. For instance, in Ukraine, this would be Alliance for Public Health. In Zambia, this is OLED or IANASO, who are conducting the monitoring and accountability. And they have an in-country community-led monitoring technical assistance who support coordination with local communities. Sometimes they act as a consortium to decide which organisation is going to lead that community-led monitoring. So partners might be able to help community groups with information. So these are a good contact point to approach if you need support and direction on who you might need to talk to. Other technical partners include, as an example, HealthGap. They have USAID funding to develop key population monitoring and accountability frameworks, and GATE as well, obviously providing this training, but provide technical assistance and ongoing support and direct connection with the Global Fund for trans, intersex and gender diverse organisations and activists. Now, I'd like to give you a prompt question to consider in your own time, or you can pause this video and add to the worksheet. Think about who are the main stakeholders involved in monitoring in your country? If you don't know and would like to find out more information, you can go to the Global Fund Data Explorer, to AidSpan, or to USAID's data portal as well through the links provided here. These are also in the summary guide. Now, moving on to the third and final part of this session, we're going to look at what is being monitored, the role of indicators and different frameworks that can help you in setting your goals for community-led monitoring. So it can be quite daunting to decide what indicators to measure against and what you might want to include in this. So I've outlined here some suggestions to get you started. So the Global Fund tends to have quite quantitative indicators. These are focused on high-level impact, they're not very participatory, and they don't often cover quality. So there's a gap here that community-led monitoring can address. If you want to focus more on qualitative indicators, this can be very complementary to that lack of data from official reporting. And you can use principles from different global, regional or national standards as a starting point to develop your indicators. So you could look at the World Health Organization's quality of care standards. UNAIDS has an agenda for zero discrimination in healthcare settings, looking at minimum services. The Sustainable Development Goals is a great starting point, looking at the indicators under different goals. National strategic plans for your national context would be an extremely useful starting point, especially if you are looking to influence the government in terms of how they're meeting the goals in that national strategic plan. And regional frameworks as well can be extremely useful, thinking about, in the African context, the African Union's catalytic framework to end AIDS, TB and malaria has some really great indicator examples. The International Treatment Preparedness Coalition has some very specific suggestions on example quantitative and qualitative indicators that could be collected through community-led monitoring in their toolkit on implementing community-led monitoring that is linked here. And I want to give you a sense of the type of indicators that are being tracked. So the Global Fund is looking at the number of HIV tests being taken, the number of people on antiretroviral therapy, the number of people with suppressed viral load, for instance, and the number of trans people being reached through HIV prevention programs, as well as the number of tests being taken by the trans population. There are grant level indicators as well. The impact indicator on trans people is measured as a percentage of those trans people living with HIV. And at outcome level as well in the grant, there are indicators on the percentage of trans people reporting use of condom in their last anal sex with a non-regular male partner. So there are indicators on trans people, not on intersex or gender diverse people, but they're also quite narrow, and it's not a requirement that you have to include these indicators in all grants. There are additional coverage indicators as well, such as the percentage of trans people reached with programs, the percentage of eligible people who initiate PrEP, and further ones on data disaggregation as well. UNAIDS also includes some indicators on trans people around size estimates, which is disaggregated by age and gender and other factors, general HIV prevalence, testing and status awareness amongst trans people, antiretroviral testing, condom use, coverage of programs, hepatitis, and avoidance of healthcare because of stigma and discrimination. Again, nothing on intersex or gender diverse people more broadly. PEPFAR uses the COP process to determine what indicators are used, and these might be different to the global funds. A few links to resources to help you find information on this. HealthGap is a great starting point, as is ENASO's community-led monitoring technical guide, which has materials on accountability as well. AIDSpan in terms of giving data, the Women for Global Funds toolkit, and as a general access point for information is incredibly helpful. They explicitly include trans women in their work, and I've included the contact person and email here, who is a great resource to be in touch with. The Global Fund has information in their data portal, and Accountability International has tracked the progress of countries against the 1990 UNAIDS target indicators, which is incredibly helpful. And you can see this here for the type of information that they are tracking. And you can use this as a starting point to, or as a baseline even, if you wanted to look at this within your community-led monitoring. Let's pause for a test question now, and please go to your worksheet to record your answer. What are useful places to look for indicators that support program monitoring? You could have answered with any of these options. You might have other suggestions as well. Let's look at a few more of the global level and institutional level commitments. These can be a useful starting point for indicators as well. So the Sustainable Development Goals, or the SDGs, are incredibly useful for framing in relation to commitments that have been made by all governments. So in particular, Goal 3, which is around health, has the target 3.3 to end AIDS as a public health threat by 2030. And target 3.8 specifically looks at universal health coverage as well. You've also got the other goals around quality education, gender equality, and reduced inequalities SDG 10, as well as peace, justice, and strong institutions in SDG 16. Each of these have their own indicators and targets, which you can use or adapt to link to your community-led monitoring goals. The World Health Organization quality of care principles are also incredibly useful as a starting point to adapt the language that's used here as the basis for indicators or goals you might want to develop. So quality of care is about services being effective, safe and people-centered, and timely, equitable, integrated and efficient. UNAIDS global targets are also an incredibly relevant source to derive indicators or goals for your community-led monitoring from. These have been updated from the 1990 targets to the Global AIDS Targets 2025, and instead it's now focused on 95-95-95 targets. The UNAIDS Agenda for Zero Discrimination in Healthcare Settings is also incredibly useful as setting out qualitative descriptors of what minimum services should look like. So this can be useful at the service level, if that's what you're monitoring, to decide or measure whether a service is meeting these quality standards. So you can see here issues around informed consent are included, around respecting patients' privity and confidentiality, amongst other aspects. Regional targets can be useful if you're working at the regional level, or if you would like to compare a single country's progress against these in comparison to another country's progress, and to use that comparison for your advocacy. So you have the Abuja Declaration, where African governments committed to allocate 15% of their annual budgets to the health sector, and you have the African Union Catalytic Framework to end AIDS, TB and malaria as well, with specific indicators around HIV and key populations within that. National strategic plans can be a really good starting point if you're interested in working at the national level, because they provide a roadmap for developing the national health policies and approaches. They set the goals for a country's plan on HIV and other diseases, and they contain indicators for progress. So it's possible to use these as a way to hold government accountable if they are not meeting these commitments. You can also use these indicators to find gaps in what is being measured and to fill that with some complementary monitoring. Under the Global Fund strategy, there are 4 core objectives which can be a good starting point too. There's performance against impact targets, against service delivery targets, and the new strategy, which will run from 2023 to 2028, sets out the new priorities, so you can also try to align community-led monitoring to these if you are looking to record something repeatedly over time which you would like to be relevant in the future. So the Global Fund measures grant level indicators quarterly. These tend to be output focused. There are work plan tracking indicators which are more qualitative, but there are no tracking routes for this, so surveys are used instead. And the Global Fund proposals also have to fit with national strategic plans. So these indicators are also first place to look. So a prompt question now to think about how this might apply to your context, and please answer on the worksheet at your own pace if you prefer. How is monitoring information used by advocacy targets like government representatives, HIV service providers in your country? So to recap, in this video we've looked at monitoring and funding for community-led monitoring and accountability. And in the next session we'll be looking at accountability and community-led monitoring tools.